Hi, this is Jenny Johnson, Shoemaker Proficiency Partner, CIRS coach, consultant, and patient educator. This video is about what to expect with CIRS treatment using the Shoemaker protocol. This is the Shoemaker protocol treatment pyramid that you may have seen in some depiction, one depiction of another. We are going to go through this together, so hopefully this makes sense and you can get an overview and maybe even a timeline of what treatment usually entails. So the treatment program starts actually at the bottom of this pyramid. So step one, if people talk about step one of the Shoemaker protocol, that is the bottom level, which is remove from exposure. So when you're working with your clinician to identify where you are being exposed to biotoxins, and maybe they will give you some guidance on how to sample your home, to screen your home with a dust sample, or maybe how to invite in a professional mold inspector to figure out if there's some issues going on with your home that need to be addressed. Or again, they might be looking at places that you've traveled, fish that you've eaten, insect bites that you've acquired over the years, but figuring out where you have been or are being exposed to biotoxins and then mitigating that exposure is probably the most important part of the treatment protocol. And oftentimes the most challenging and sometimes the most costly and time intensive. It can take a while to identify exposures and then to fix them. So that is a process, and that is something that we'll be talking about in another video with how to navigate inspections and remediations. But the next step after you identify and mitigate your exposure to mold, endotoxins, and actinomycetes, the next step is to take a binder to pull out the acquired biotoxins from your body. So CSM in step 2 here stands for cholestyramine, and Welchol is another binder. These are both prescription binders that are evidence-based, very effective for pulling biotoxins out of the body. They actually have a positive charge to them, a net positive charge, and most biotoxins are negatively charged. And so through that ionic bonding, they can effectively pull the toxins out of your body that you are unable to eliminate on your own, particularly if you have the genetic susceptibility. So we're out of exposure. We are now in a binder, which is something that you take by mouth. You might drink, or they might be pills. But you're going to take this by mouth several times a day, and that's going to pull out the acquired toxins. You're going to follow your clinician's instructions for when to take your binders, how often to take them, and how much to take. It really is, there are some general guidelines, but I encourage you to follow what your clinician is asking you to do. The next step, once you've been on a binder for a little while, is to test and treat for MARCoNS. And again, we've talked about what MARCoNS testing is a little bit, but this is a nasal swab that is a test kit with including a nasal swab that can be ordered through Microbiology DX directly by patients. If you don't live near your clinician, they might send you a kit, or they might tell you how to order a kit. If you do live near your clinician and you can go into their office, they will likely have this kit on hand for you and be able to actually do the swab right there for you. It's a lot like a COVID test. The nasal swab is. They give you instructions on how to swab both nostrils, and then you send it in. And a week or two later, you should get the results saying whether you are MARCoNS positive or MARCoNS negative. MARCoNS stands for multiple antibiotic resistant coag negative staphylococcus. This is an opportunistic bacterial infection, not a fungal infection. And if you are MARCoNS positive, then that means you do need to have treatment for that. We want to eradicate that because it is a biotoxin producer in and of itself. So even if you've removed yourself from external exposures, from water damage, you've mitigated maybe endotoxin exposures, actino exposures. If you don't know what I'm talking about, there are additional videos for that, or please ask your clinician. And then you're on the binder. But if you still have MARCoNS, then your body still has an internal factory of biotoxins. So technically you're still in exposure if you have that infection going on. So you want to take a nasal spray. Again, your clinician will guide you in the type of nasal spray that they want you to take and how often and how many doses. So you're going to follow their instructions to take a nasal spray along with the binder that they have you on to capture those toxins and pull them out through the stool. So that's step 1, step 2, and step 3. You might need to be on MARCoN spray for a little while. Some people eradicate it in just a month or 2, and for some of us, it takes a little longer. You might need up to 6 months, maybe even longer, to be on that MARCoN spray before it is fully eradicated. In the meantime, your doctor will likely be having you do some repeat lab testing. So initially, when you were first diagnosed with CIRS, you probably did a battery of blood labs. And throughout this treatment protocol, your clinician will have you redo those blood labs to see if they are starting to normalize. Typically, after removal from exposure and being on MARCoNS, that might be a time to redo labs, or maybe waiting until you're done with the MARCoNS treatment, maybe then redoing labs and seeing where things stand. These here, the correct anti-gliadin, correct androgens, correct antidiuretic hormone, all of these up here are very specific to the labs that may still be dysregulated for you. So when you redo your labs at some point, and in these first few steps here, you're going to see which labs have maybe already normalized on their own and which ones have not. And the ones that have not, there's a direct intervention for each one of these biomarker dysregulations. And so if you still have maybe elevated MMP9, even though you've removed yourself from exposure, you've been on a binder, you've eradicated MARCoNS, or maybe you're on MARCoNS spray, but if your MMP9 is still a little bit elevated, your clinician will have an intervention for you to start bringing that down. For MMP9, that happens to be high-dose fish oil and perhaps a low amylose diet, and they will give you those instructions. So for each one of these labs, if it's still out of range, there might be a supplement, there might be a pharmaceutical, there might be a dietary approach to help bring all of those biomarkers into range. The last one on here, this is VIP, which stands for vasoactive intestinal polypeptide. This is actually a lab test. This is a biomarker that you can have done as part of your initial diagnostic workup, but it's also an intervention. This is also the term for a nasal spray that your clinician may diagnose or may prescribe for you at some point along your treatment. So we have it at the top here because historically it has been the icing on the cake after going through all of the other steps. So if you still have some symptoms that have not resolved, specifically brain fog, this is one of the big ones that VIP can help with quite a bit, and that persists kind of closer to the end. Or if you have 1 or 2 or more of these labs that are still not regulated, even though maybe you've done some direct interventions and they're still a little bit elevated or depressed, they're still out of range, VIP can help bring a lot of balance into these labs that are being stubborn. And so it is usually not prescribed until at least after the step 3, eradicating MARCoNS, because it tends to not be effective in resolving symptoms and in normalizing these biomarkers until you're at least past step 3 of the protocol. And so we consider it kind of a waste of money. If you try to take it too soon, it's just not going to work. But once you're past step 3, it can really help to normalize these other labs and to help bring a lot of your symptoms into balance. Some clinicians will actually use low-dose VIP spray even earlier than step 3. Some are starting to use it actually at step 1, particularly if somebody is having a hard time tolerating cholestyramine or Welchol. Low-dose VIP can really improve your ability to tolerate this binder. So this is the core of the Shoemaker protocol. There are some clinicians who will maybe add in some supplemental tests and treatments. We call that padding the protocol and not changing the core of the protocol, but they might find some additional hormones that are out of range, like thyroid hormones, or they might find some food intolerances that might be at play, or some sleep apnea. They might do some additional testing depending on their expertise and in their treatment approach. And they might be addressing some ancillary things in addition to the core of the Shoemaker protocol. So a lot of times people will ask me, what's the time frame for this? Can you give me a general timeline of what to expect? And it is really, really tough to do that because so much of it depends on step one. So if let's say that your exposure was from a vacation that you went on and you ate some reef fish and you developed a chronic multi-system, multi-symptom illness, CIRS, from exposure that is now over with, and you test your home, maybe with an ERMI dust kit or an inspector or another manner, and it is deemed appropriate for healing, you are golden. You've bypassed the longest step, at least for most of us. So removal from exposure, if you can if you can bypass that step because you've already achieved it, then the rest of this really shouldn't take too terribly long, especially if you're able to tolerate the full dosage of a binder fairly quickly. Some people need to titrate up a little bit slowly. They don't tolerate the full dosage and things might take a little bit longer to get those acquired toxins out of their body. So the quicker you're able to take maybe close to the full dose of cholestyramine, that can make your treatment progress a lot quicker as well. Another thing that can really impact the timeline is MARCoNS. Like I said, it can take 6, sometimes even 12 months of treatment to eradicate MARCoNS fully. And it's hard to fully progress along the treatment protocol if you still do have MARCoNS. So if you don't have MARCoNS, then you can sail past that step as well, and things can be a lot quicker. So it really is tricky. This can be anywhere from 3 months to 3 years, depending on the specifics of your scenario. Ideally, we like to say 6 to 12 months is fair. Maybe 12 to 14, somewhere in that range might be average, given some of these individual considerations that could be in play and make things different for one person to the next. I'm going to share an additional perspective that is not necessarily part of the Shoemaker protocol, but this is more of a maybe functional medicine or holistic lifestyle medicine, body, mind, spirit approach to healing. And I'm going to offer this as well so that you can have another maybe perspective on what healing can look like from CIRS. So in this perspective, the first step or the first category really is to reduce exposures to toxins and inflammagens, body, mind, and spirit. So we've talked about environmental toxins like mold, bacteria. Sometimes for people that can be other things. But in addition to the airborne, I guess, toxins and water damaged buildings, some people find this to be a great time to reduce other inflammagens and toxins from their lifestyle. So that might look like getting a water purifier. That might look like eating differently and reducing inflammatory components in your diet. So maybe reducing alcohol, sugar, eating organic or non-GMO for a time period, reducing packaged products and processed foods can really be part of an anti-inflammatory lifestyle. Paying attention to the body care and household products that we're using. This could be a great time to reduce the toxins that are in the things that we're putting on our body or that we're spraying around our house. Some people find great benefit by reducing electromagnetic frequency exposures. So maybe hardwiring their computer instead of having a lot of Wi-Fi going on, or turning off their router at night, putting their phone in airplane mode, or even going to more extremes than those things can be helpful. Relationships, emotions, and mindsets or limiting beliefs. These are things that are more internal, but they can be either assets or liabilities to our recovery. And so I think it's a time when we can be invited to consider, are there other things in our body, mind, spirit that need to be reduced? Are there relationships that I just need to hold at bay right now because they're not going to be part of my healing process? Are there emotions that I need to try to protect myself from, or limiting beliefs that I need to maybe change? So category 2, or step 2 of this approach, is to remove the unavoidable toxins and inflammagens that have already come into our being. So whether those are toxins that we've breathed in over the years, biotoxins, chemicals, heavy metals, things from food and water, or maybe these are beliefs, mindsets, relationships that already part of who we are. How can we remove their influence on our experience as we're trying to heal? And so certainly that can look like binders. We're talking about the Shoemaker protocol. So for biotoxin removal, we're going to be using binders. Your clinician may recommend supplements. They may recommend sauna, certain types of exercise or lymphatic support, Epsom salt baths. There are lots of ways that we can help our body to remove biotoxins, chemicals, other things that maybe we've acquired that are filling up our bucket of toxins and can be an obstacle to healing. And then removing the limiting beliefs or maybe challenging relationships and emotions through counseling. There are other practices that can be very helpful for that softer side of inflammagens. And then enhancing. So enhancing our foundational terrain so that we can handle a little bit more. So enhancing our capacity and our resilience, essentially upgrading our operating system. So we're going to be building foundational wellness with our sleep and with movement and with eating well and bringing in mindsets that are salutogenic rather than pathogenic. So this category is more about what I call planting flowers in our garden, bringing in salutogens, the things that make us well of body, mind, and spirit, rather than just focusing on pulling out the weeds, the reducing and the removing, bringing in the good. And that can give us the end result that we're looking for, which is really a beautiful garden of well-being and wellness and resilience against maybe future exposures. Thank you so much, and I look forward to seeing you in another video.